Okay, so let's talk about the autonomic nervous system here. So when it comes to the autonomic nervous system, a lot of this is anatomy based, but I think it's important to understand, especially as we go forward throughout the rest of the semester. So when it comes to the autonomic nervous system, the pathways generally, not always, there's one exception, have two neurons, a preganglionic and a postganglionic neuron. When it comes to each of these neurons for all of the pathways, you need to know the following: the length of the neuron, the relative length, whether or not that neuron is myelinated, what neurotransmitter is released by that neuron, and then what kind of receptor type that neuron activates. All right. Now, when it comes to the sympathetic nervous system, it's the fight or flight. So think of it, what happens physiologically when you see a bear? Okay, whereas the parasympathetic nervous system is the rest and digest. So after you've eaten a big meal, what's going on physiologically? So decreased heart rate, decreased blood pressure. Blood's going to your digestive system so you can break stuff down. Now with these pathways, there are actually 4 pathways that we're going to talk about. We've got 3 in the sympathetic nervous system, but only 1 in the parasympathetic nervous system. Okay, and so I've drawn out these neurons here. Okay, and as you can see, you've already got some of the answers right away. So we're going to make myelin brown. So this is myelin. Okay, so again, focusing just on the parasympathetic nervous system. So the preganglionic neuron is long and it's myelinated. Okay. It releases acetylcholine onto a nicotinic cholinergic receptor. Okay, and this receptor is actually on the postganglionic neuron. Okay. Now, if we talk about the postganglionic neuron in the parasympathetic nervous system, it is short, it is unmyelinated, it releases acetylcholine, okay, but it activates a muscarinic cholinergic receptor, okay, and we're just going to say this is on the heart somewhere. So there's my muscarinic cholinergic receptor. Remember that muscarinic cholinergic receptors, as well as adrenergic receptors, are G protein coupled receptors, whereas the nicotinic cholinergic is just an ion channel. Okay? All right, so now let's talk about the sympathetic nervous system. Okay, so the sympathetic nervous system, so this is normal, or typical is probably a better way to put this. We have a short but myelinated neuron, okay? And actually, in all cases, these are all myelinated neurons. And we'll go through each of these, but that way I just have to draw the myelin once. Okay, so we've got a short myelinated neuron. Okay, this neuron, it's considered a cholinergic neuron because it releases acetylcholine, and this is true everywhere. Okay, now it releases this just like the parasympathetic side of things. It releases this onto a nicotinic cholinergic receptor. Okay, so we've got a nicotinic cholinergic receptor, and we're going to fill in the blank here on this one on the bottom. All right. And so that will activate this postganglionic neuron. And typically, or well, not typically, but this postganglionic neuron is long and it's unmyelinated, but it releases norepinephrine, okay, onto an adrenergic receptor, which I think I had as this color. So here's my adrenergic receptor. Okay, again, that's a G protein pathway. Now, when it comes to this first exception, this is with sweating or goosebumps. Okay, so it has a short myelinated preganglionic neuron that releases acetylcholine onto a nicotinic cholinergic receptor that will activate this postganglionic neuron, okay, that is long and it's unmyelinated, but instead of releasing norepinephrine, in this case, it actually releases acetylcholine. Okay, and it releases acetylcholine onto a muscarinic cholinergic receptor, which is here. Okay, so think about that on your sweat glands. Okay, and then we go through that G protein process and you start to sweat or you get goosebumps. Okay, the other exception, oops, that's not a good color. The other exception, we'll do it in this color, is with the activation of the adrenal gland. Okay. So with the adrenal gland, you have a short myelinated preganglionic neuron. It releases acetylcholine onto a nicotinic cholinergic receptor. And so here is my adrenal gland, and contained within my adrenal gland is a bunch of epi, okay? And so a bunch of epi is released into the bloodstream. So I'm going to draw my bloodstream here. So there we go. And that epi gets carried away into the bloodstream. Okay? And so we can answer two questions just based on the anatomy and the things that we've talked about. Okay? So in this case, the parasympathetic is fastest because it has more myelin. Okay, notice that we travel all this distance on the postganglionic neuron that's myelinated compared to the short myelinated neuron in the sympathetic side. So the fastest is the parasympathetic side. However, the adrenal gland, because of the adrenal gland and the fact that we dump all of this epinephrine into the bloodstream, the sympathetic nervous system is the longest lasting because of epinephrine. This is due to epi in bloodstream. Okay, this has nothing to do with the amount of myelin. Okay, the amount of myelin just means that the sympathetic nervous system is slower to act, but it has nothing to do with why it's longer lasting. That has everything to do with the epi being dumped into the bloodstream. And so kind of there's your basic overview of the sympathetic nervous system and the parasympathetic nervous system and their anatomies.